Oh my gosh. Okay, wait. Hi. Y'all, this is terrifying. I've never done an Instagram Live before, and for good reason, because anybody who knows me knows I don't understand the internet. It takes me ages to post anything, and I usually have to redo it. So here we go, trying to, guys, I know some people on here already. That's hilarious. Okay. I'm going to really try to be a professional person and figure out how to do this. I'm going to be, can you guys tell I'm nervous? I'm nervous. Oh, I see you. Okay. I am going to request Dr. Wertheimer, my friend, who we are going to have a little chat. How do I do that? Okay. I can't figure this out, and now here I am. I'm doing the thing. You're making me nervous.
Hello.
You're making me nervous. I'm like, I understand. I know. Sorry.
I'm like, you're an actress. You're not nervous.
Oh no, I'm nervous because I don't like the pressure because I say things without thinking. It's a huge problem of mine, and so I'm just like, whatever I say, here we go.
I also
It's out.
I also have a no filter problem. So let's see how we do.
Yeah. So I am so excited to talk to you because you've become such a good friend of mine, and I love you, and thank you so much for giving me all of your knowledge and expertise. And doctors can be very scary sometimes, and you are just the coolest. So thank you.
Yeah.
And I'm really excited for people to listen to this because I didn't have a lot of information going into asking you questions about reproductive health. And I didn't even know a lot of things that some of my friends are struggling with now. I couldn't even give them any support or answers. I would have to look it up on the internet. And you know, that whole rabbit hole, it's so hard to differentiate what is actually, hi, Alex. Alex is on here.
Hi.
Um, it's so hard to differentiate the difference between people just going, down this whole rabbit hole and freaking themselves out, or what's actually substantial information. So I'm really excited for you to, enlighten us with your knowledge on
So much.
this many topics. So let me give some context of people who are on this and are asking themselves, why am I doing this? Because it
Okay.
is a little strange. So about my dad was diagnosed with prostate cancer when I was a kid, and he recovered from that, thankfully. But then a year and a half ago, my mom got diagnosed with cancer as well, um, and she has a different form of cancer. But I got a little bit scared. I realized that the the likelihood of me having something in terms of it not being the percentage of it wasn't going to be good. So I ended up doing a gene test, which I know that a lot of people think that's a privileged thing to do. I didn't do that scan thing that costs an absorbent amount of money. I went to a center and the cost of the gene test was $250, somewhat reasonable, although yes, expensive, but in the grand scheme of things of asking if you have a cancer gene. And I ended up being someone who has a gene that is a gene mutation for that affects my reproductive health. So, as you know, I freaked out and came to you with a lot of questions. Um, Definitely because I don't think that this topic specifically is talked enough about because people aren't really testing for their genes. And I think a lot, unfortunately, more people are going through cancer scares with their parents now and things like that. And it's really in our best interest to be proactive instead of reactive. So, can you tell me what that means for me when I came to you with this information and what I could do to be proactive?
Yeah. So that's I love that you're talking about this and being open about it. I would say that, first of all, taking a step back and talking about genes, there's autosomal dominant genes, which if somebody in your family, if you inherit it, you are likely to have the outcomes of that gene. And then there's autosomal recessive genes where if you and your partner procreate and you each overlap for the same gene, your fetus or your baby has a 25% chance of carrying that gene. So just to, and then there's other ways of inheritance that are a little bit more complex and stuff like that. So you were testing for a gene that you wanted to see if you carried it. And that can have a real effect on your health. And I think that it's unfortunate that somebody would call that privileged. I think that that's awareness and education. And I hope that it will be covered by insurance for everybody soon and not something that, that costs anybody money. So when, that gene that you specifically mentioned, so basically there are some cancer genes that we can test for, and we don't go looking for these genes in everybody, like just taking people off the street and checking them for like 40 random cancer genes, because we know that these genes have an increased risk of these cancers developing in people that have family histories. And so that's kind of like the red flag that says, okay, like it might be worth it to test you, your positive gene might mean something more than somebody random who just tested positive for it. May not mean anything for them. And so I think that these cancer genes are really important to test for two reasons. One is your immediate health, and one is your future children's health. And so for your immediate health, a lot of these genes, depends which one and depends which cancer, there are things that we can intervene with now to help your life be healthier. For example, you can do earlier screening tests to look for the cancer. So like we start looking for breast cancer at age 40, we start looking for colon cancer at age 50. But if somebody is predisposed to colon cancer, maybe they do colonoscopies a little bit earlier. And then sometimes there's risk reducing surgeries you can do to remove the organ, at a time that can help decrease the risk of cancer. And for example, the BRCA genes that a lot of people carry for breast and ovarian cancer, we know that removing the ovaries after childbearing years but before menopause can decrease the ovarian cancer risk significantly. So it's like, if there's an intervention that you can do, why not get educated about it? Right. And then for your future children, nowadays we have IVF where we can check the embryos for specific genes. And it's a very ethically tough decision, I think, for people, because they might say, like, look at me, I've lived a full life and I have this gene. Why would I prevent my child from being born with that gene? But also, like, if you have a few embryos and you want to choose, maybe you say, I don't want him to live through or her to live through, what my mother had to live through, for example.
Right. And this is such a polarizing topic, and one that because of being through, a bunch of my friends are going through this journey. One of my really good friends, Leah, she wrote and directed and starred in this movie called Scrambled that is out right now and everyone should see it. It's so good. It's like, sobbing, crying. I love it so much. And really it's about being a woman in her 30s and freezing her eggs. But I think a lot of people forget that, that's one facet and one subsect of why you would go about freezing your eggs or going through IVF. I think there's a lot more, there's different, things that you actually have to think about with the gene testing, with PCOS, with different, things that a lot of people are not talking about, where I think there's just this one sort of preconceived notion that, oh, you're doing this, you're freezing your eggs, or you're going through IVF because you can't get pregnant, or you're planning for your future child. But can you walk me through all the different ways that people are actually being proactive in their health that have, sometimes nothing to do with the I'm 30 and I'm trying to, have a career sort of like quote unquote way that people I think about this as being only.
Yeah. So fertility preservation, doing it young, can be for a multitude of reasons. It can be because you haven't found the right person yet to be your lifetime partner, and you want to kind of give yourself a little back, like the empowerment of being able to not have to settle. Hopefully nobody is, but the biological clock is real. And then there's other things like, for example, if you know that you have a gene that you're going to want to be doing IVF on in the future, we know that if you're going to be freezing your eggs younger, that's a better bang for your buck. You're much more likely to take home a live birth if you're younger because of the quality of your eggs and also because of the quantity of your eggs. So if you're going to be doing it anyways, and why not just do it younger and freeze the eggs younger, get that lock that quality in or put it in on ice, because you're going to have to do this intervention in the future. Another reason for that might be same-sex couples, right? Like if you know that you're going to want to procreate later with a sperm donor, why wait until you're, however many years old to preserve that fertility? And the gene reason is when I have patients that have endometriosis. We know that women with endometriosis, their egg reserve can go down quicker than other women. Their egg quality can go down quicker than other women. So freezing your eggs or freezing embryos, if you are with your lifetime partner and it's just not the right time, is really just a way to kind of give yourself a little bit of an insurance policy and a little bit of an edge over the biological clock.
And what is the difference? Because I have no idea. And actually, a couple of days ago, my friend and I were talking, and she said that she was diagnosed, and she has a child, and she wants to have another one. And she was like, "I just got diagnosed with PCOS, and so this is now going to be a little bit tricky." And they were like, "You should get on this right away." But she wasn't quite sure if she wanted to do that yet. So what's the difference between, because you go down this internet hole, and there's a bunch of different information between PCOS and endometriosis. Sorry, I can't talk. You take it from here.
Endometriosis. Too many
Endometriosis.
syllables.
Yeah.
It's so funny. Whatever. One of our friends was telling me about like all these acronyms in the film industry, and I was like, "Wait, what? What?" And then I'm using my own acronyms. Like everybody has their own
Yeah.
words.
You can teach me and I'll teach you. We'll do that later.
So PCOS is a misnomer. It technically stands for polycystic ovary syndrome. And so people come in thinking that they have lots of cysts on their ovaries, or they'll tell me, yeah, I used to have cysts on my ovaries. It's a misnomer. It's not because you have cysts on your ovaries. It's because you have a higher follicle count than other women your age usually.
Is that a good thing?
I like to tell my patients it's a double-edged sword.
Okay.
So like on one hand, if you want to, you want a lot of eggs, right? Because you want to be able, there's a funnel in terms of making a baby out of those eggs. We lose eggs at every step. And so if you start with a wider funnel because you have more eggs because you have PCOS, for example, that's an advantage. But on the other hand, PCOS comes with this like micro hormonal milieu in your ovaries, in your uterus, that can make it harder to get pregnant. So it's about navigating, both of those aspects. We know that women with PCOS, so the main hallmark feature of PCOS usually is irregular periods or an elevated level of male hormone called androgens in their body. And that can either be through blood tests like testosterone or DHEAS, or it can be through like acne or male pattern hair growth on their body. And then those women also, we're seeing a huge amount of insulin resistance and sometimes subclinical in those women. And that can lead to problems developing the follicle, problems with ovulation, problems even with implantation and miscarriages, which is a little bit lesser known with PCOS. And so a lot of times women with PCOS, all we have to do is to help them induce ovulation because they may not be ovulating regularly. And if we can get them to ovulate regularly using just pills, they may be fine. But then we know there's also a subset of women with PCOS where their hormonal imbalances kind of make it hard even with the pill, even if we induce ovulation. And so something like IVF might help us control some of the factors a little bit better.
For all the people that are coming in here being like, what the hell are y'all talking about? I just want to give a little bit of context to people who are on this now. Dr. Wertheimer is a friend of mine, and once I started going down this sort of rabbit hole with my gene mutation, but also because I was in a short film called Red, White, and Blue that's coming out, or is out, I guess, right now. Woohoo!
Are you going to say it's Oscar nominated?
Yes, but we'll see about that. But I really wanted to get some more information and actually help my friends and myself really understand the information that's out there that can sometimes be a little bit confusing. So if you are scared of this conversation, then hop out of this live and don't at us because it's going to be very female driven, and I totally understand that this is scary and sometimes a little bit too much for a lot of people. So let's go back into it. And so you were talking about PCOS, and now with the word that I can't say, and
Oh,
then
endometriosis.
yeah,
Should I
yeah,
explain
yeah,
endometriosis? Okay, so endometriosis is when some of the lining of the uterus implants outside of the uterus. So there's different theories as to why that might happen, but it implants, let's say, in the ovary or the pelvic cavity, and it causes inflammation. And that's because those cells are responsive to hormones, just like your uterine lining is. So just the fact that we took them out of the uterus, when your body is going through that menstrual cycle with all the fluctuations, those cells are still responding. And that causes pain, it causes inflammation, and it causes scar tissue to form in the pelvis, which can make it there's so many parts of endometriosis, but the main hallmark usually is pain. And we know that women can go 15 years without getting diagnosed with endometriosis. They just kind of get gaslit by healthcare provider after healthcare provider, because it's kind of like a silent disease in a sense that you can't like look and necessarily see it on an ultrasound or an MRI or whatever, unless you have a cyst in the ovary. That's a very obvious telltale sign. So
what do they usually say it is for the people that are maybe getting that
I mean,
feedback?
they'll look for things, and sometimes these women have GI symptoms, so they'll go down like a whole GI route, and it ends up not being GI, but it ends up being the endometrial implants on GI organs or bowel, and they'll go through like a whole gut analysis. They'll go through they could even go through pelvic pain analyses and not see anything. I hope that we're in an age where if you see a gynecologist and you're talking about this type of pain, there are some like hallmark things that we know probably are endometriosis, like for example, cyclic pain with your menses, if we're not finding it, any other reason for the pain. Pain with deep penetration, and that's because we know that there can be endometriosis implants on some of the ligaments deep in the pelvis. And usually it's that cyclic type of pain that kind of goes with your menstrual cycle. It's because of the way the hormones are, that time, a certain time of month, not just chronic. But sometimes people have chronic pain and they're being told, like, we don't see a reason for your pain. Sometimes people think that they're drug seeking, or they'll have like other diagnoses that start, nobody's believing them with their pain. So they end up having depression, they end up having fibromyalgia, and it's an unfortunate cycle. And ultimately, when you do find a provider that diagnoses endometriosis, I think they feel very validated. And also, there's things we can do about endometriosis, which is nice and a reason to diagnose people.
And so if you have, these sorts of things and you want to be able to go through your fertility journey later, is it recommended that you go a certain route with the egg freezing, or because it's going to be a little bit more difficult?
I would say yes, because endometriosis is usually progressive and it can get worse if it's not well controlled or surgically removed. And we do have a lot of data on these women. Even if their eggs are put into gestational carriers, they have decreased fertility. So I do think that there is something with the egg quality, and also with implantation we're learning. And then not only that, but the actual like treatment of endometriosis sometimes ends up being surgery to remove endometriomas on the ovary. And that's catch-22, because on one hand, you need to remove the implants to help them feel better and also to improve egg quality. But on the other hand, every time you touch the ovary and remove tissue, you're decreasing their ovarian reserve. And so the best thing is to really be aggressive in terms of fertility preservation. I see a lot of great providers these days sending us patients for egg freezing before they get their surgeries done, or we have a plan to do it right after, depending on the scenario. And so I would say if you have really severe endometriosis, it's definitely a good idea to be freezing your eggs younger.
And how do you go about finding someone like you who does these sorts of things, that has great, relationships and care? And it must seem overwhelming for a lot of people if they're having these symptoms, or if they do just want to freeze their eggs, or if they're feeling pressure about, life and the the intricacies of it, how do you go about finding someone to start this process?
I think that, I mean, first of all, there's a lot of providers on Instagram trying to show their, trying to educate. And I think that's a great place to start and to see if you connect with somebody, if that's your world. But also friends, like who had a good experience with, who I think word of mouth is how I get some of my favorite patients. And I would say that you can make consults with more than one doctor and see how it goes. I think that you really need to feel, like, I think that there's this way that healthcare used to be, and that whatever the doctor says goes. And these days we're seeing patients that are much more educated and much more, much better at self-advocating. And I would say if you don't feel like your doctor's listening to you, or you don't feel like a good vibe with your doctor, go somewhere else. There's a lot of us, and I know I have a lot of colleagues in the field, obviously, and there's so many of us that are well-meaning and research-driven, and you have to be able to find somebody these days. And they're like, talk about your seminar. We will be doing a fertility seminar soon at HRC, and we'll post the details soon to just talk about some basics. But I just really wanted to drive home that point about the self-advocacy and making sure that you have a doctor that's listening to you. I know from somebody who's in healthcare and watching family members go through things, it's really crazy. You can, once you get somebody on the phone that says, I'm actually a doctor and I don't like the way you're taking care of my family member, it can be very different. And it's unfortunate. We just have to find the right providers. And within the fertility world, what I would say is that the lab matters too. So you want to make sure you're going somewhere with a really good lab. But once you get to a certain standard level of lab, right, I feel like a lot of the major labs in this area are also excellent. I'm going to be honest. And I think that ultimately parsing out 1% differences on this or that when you don't know how people report their statistics is not going to be your make it or break it. What's going to be your make it or break it is feeling like you have a provider that's on your team.
Gotcha. And so, I mean, for me, these conversations are really, really important because I think there is a lot of stigma around reproductive health care and, reproductive health care in the way of I'm going to, pivot to red, white, and blue a little bit. I know this is like a polarizing topic and something that if you haven't seen the short film, I would urge people to rent it and watch it so this doesn't seem like an out of nowhere conversation. I know that this is a very hot button topic, but I think as a doctor, I'd love to get your expertise on this, just not to scare people, but I really think it's an important topic because I was just looking at your Instagram and you did something about a woman in Texas, Katie Cox.
Yeah.
These are examples that, I think people need to start talking about and looking at. I'm sure I will lose followers for this. I don't really care. Because I think that it's so important to spread awareness that there are so many other things that happen in this category that have nothing to do with using this as a form of birth control. This has to do with actual medical women's healthcare.
Totally.
And so please watch Red, White, and Blue so you know what I'm talking about, and you can take it away from what you have found in your practice.
Yeah, I think that it's really unfortunate how political this topic has become. And I think that people are not thinking or not doing their own research when it comes to what exactly this encompasses. I am personally an Orthodox Jew. I think that a lot of people think that Orthodox Jews absolutely say no to abortion. I actually had my own abortion for medical purposes. I had a fetus that had a neural tube defect and it was not compatible with life. And I think that what people forget is that, thank you. I think what people forget is that pregnancy is not a health neutral state. Pregnancy is a risk to a woman, even in its best case scenario. A lot of your physiology changes with pregnancy. And if you decide that that pregnancy is not going to give you the outcome that you want, who is your state government to tell you, no, you should risk your life for this fetus that's not going to make it? And I think that people are forgetting that quite often.
The fetus is not going to make it. I think that that's a really important part of this that I think a lot of people are not, there's a lot of anger on this topic, and I completely understand because I do see, sides of this in some areas. I won't get into political things, but I was born and raised very much, in a different viewpoint than I am now. And I think that because, I have friends who have had pregnancies that would not have come to term, that they actually would have risked their life to give birth to something that was not a viable pregnancy. And I don't think that that's happening or
Right.
talked about enough,
Right.
that um, the right and the fact that that is taken away just because it's a
Mm-hmm.
law is really something scary.
Yeah, and I think also the other thing is that people think this is dramatic and that there aren't actual examples of this happening. And I have a personal friend who lives in a state where you cannot get an abortion past a certain amount of, and she really highly desired that pregnancy, and she actually kept it going past when the doctors told her that it was probably not viable because she really wanted some miracle to happen. The miracle didn't happen, and she ended up having to fly to New York to get her termination. And I think that is a failure of the healthcare system. So I really just, what I wish is that people will stop making this so political, and stop putting blanket statements and stop judging each other, and really, just really understand what this means for our healthcare system. I mean, recently in Alabama, they ruled that embryos are basically children, and that somebody who had their embryos destroyed was trying to sue for a wrongful death of a minor. That's how the Supreme Court is ruling. It's probably going to make it to the federal level. But to me, it's like this talk has no ends. The range of implications, it's so wide, and we need to really look at each case individually and understand and feel empathy, at the very least empathy, right?
Yeah.
Even if your religious beliefs are telling you no, that can be your choice, but empathize. I think that's the most important message.
I agree. I mean, I think there's so many case by case based, things
Yeah.
that are actually changing, and it seems so hard to have a blanketed statement of this when every female body is different and every pregnancy is different. And thank you for being open about your pregnancy as well, because I would imagine that as a doctor, and also because of your religion, people would not think that would be your experience.
Right.
So
Right, and I've been very open about it within my community too, because I actually our rabbis or our Jewish legal advisors would say it's okay, but people are just so they just know what the political implications are, and they haven't really done any deeper research, and so I think that's just so unfortunate. Like, if my ethical advisor and me and my husband think that this is the right move for me, like it doesn't seem fair that the state should get involved. They don't get involved in your other healthcare,
right. Yeah, I completely agree. I mean, this has been something that I wasn't well versed in, and I'm still learning and discovering as I go. But because of being in red, white, and blue, and I think that now I know a lot more about how many cases there are, and just the implications of this, and just the toll that it's taking on so many people for feeling like, they're alone in this. And I think that's really sad, because yes, you're right, all we need to have is empathy in this situation. And yeah, I wanted to hop on here to like talk to everybody. It's funny because even as I'm talking about this, I'm noticing comments of people being like, Brittany, smile. Why are you so serious? Why aren't you smiling? Which is so much of an indication that I think people want everyone to just be happy and do what they want them to do. And I think that everybody is an individual. Everybody has their own life and things that they're going through, and nobody should be talking about someone else's, experience for themselves. So I really thank you for doing this. I know that this was a 30-minute chat of a lot of information for a lot of people. Is there anything that you want to add and leave us with? Because God knows I have so many more questions, or we can actually ask people if they have any questions.
Yeah, I mean, I haven't been looking at the comments, but I feel like I saw some on PCOS.
All I saw was smile. You look so sad over and over again.
I think you look very happy and gorgeous.
I was like, I'm fine.
No, people, they just care about your happiness, Brittany.
That's sweet.
Okay, I'm not really. Do you see any questions?
Yeah, let's open this up to people who, it could be anybody who's going through infertility or fertility struggles, or maybe just something with PCOS or any questions. I know that there was a couple questions that we didn't address.
Oh, I see one that I think is a good one. I see people saying, what do you think is the biggest misinformation about fertility? Oh my God, there's so many. I think one that's very recent has been about birth control pills. Do birth control pills cause infertility? They do not. We have tons of data on this. I know Elon Musk recently had a tweet that made people think about all the risks of birth control pills, and I think that's legit. There's risks to birth control pills, but I think that people forget that we're often comparing birth control with pregnancy risks and deciding everything in medicine is a risk-benefit analysis. And pregnancy comes with so many more risks than birth control pills. And so that's just something to, pregnancy, it has a high risk of depression, high risk of suicide. All the things that he mentioned are greater in pregnancy. But I also don't fault him for mentioning that, because I think people also just think of birth control pills as like, something really like standard. And everything in medicine, if anybody ever tells you there's a medication you can take and it has no risk, they're lying to you. Any intervention has a risk. It's all about, do you think the risks are worth the benefit? Other misconceptions about fertility, I think a lot of times people think it's always the women's issue, and a lot of time, 30% of the time, infertility is due to male factor. I think people think infertility is really uncommon. The CDC recently came out with data. Infertility is 1 in 5. So everybody knows somebody struggling with infertility, and for that matter, probably everybody knows somebody who's had an abortion.
Right. And what is I have so many friends, God bless them, I love them so, that are dealing with infertility right now. Some of them I gave to you. And I wonder, and I think they've been wondering a lot, I'm not down this journey yet, but what went wrong? What is the percentage of what could they have done something different? Is it them? Is it their body? Is it their husbands, wives, whatever? So what do you say is like the biggest factor of infertility?
Actually, most of the time the cause is unknown, and we have a lot of unexplained infertility. And I think that also plays into like this feeling that women we always feel like everything's our fault, and it's not. And I think that there's just there's so much. I would say one of the biggest factors that can cause infertility is the aging process and the biological clock. As much as we don't want to admit it, our eggs start going down in quantities from the minute we're born. And it does accelerate around age 35 to 37, both in quantity and quality. And so that's something that I think that number 35 is out there, and people are so scared of turning 35. And what I like to tell my patients is, you don't jump off a cliff when you're 35 and no longer have eggs. No, it's not. You still have eggs, and I think also a lot of times it's just that the rate of the slope becomes a little bit steeper. And I think people also, I have had a lot of patients come to me in their late 30s, and they're like, "Am I too old for this?" And I'm like, "No, like this could be life changing still for you." Like, I would say in your late 30s, even in your early 40s, it's still absolutely worth it to come have the conversation.
And what is, this is actually a really hard question that I don't know if there's like a good answer for, to be honest, but I guess I have to ask it. I think a lot of people feel like, well, if they're over the age of 35 and they don't have the means to go through IVF or freezing their eggs, is this a privileged sort of person's thing? Is there anything that people can do in terms of not having to spend the exorbitant amount of money that people, I think, assume with egg freezing?
Well, right now we're having a special.
And special.
Yes, we are. We're having a special. It's almost like you knew.
I didn't know.
I know. I want to tell people like you didn't know. You're just asking. But we do have a special right now. But in general, I do commiserate with that. It is expensive. And there are insurances that cover it, especially in LA. A lot of people that work in the industry have insurances that cover it, and they don't even know about it because for some reason your employers don't want you to know. So I would ask questions. I would go to your HR department and say, hey, can you offer infertility coverage or egg freezing coverage? Like, get a bunch of people together. Because at the end of the day, we just need to influence policy. But what I will say for right now is that a lot of places will help you with financing it, either through their own company or through a third party lender, and make it much more bite-sized and easy to digest. And then also, like, I know it's expensive, and I don't think it's privilege. Some things are expensive, and I think that it's a question of priorities, right? It's not it's where you, and I hate that this is even something that we have to do, but I think you really should prioritize it and try and save for it, or try and I don't know.
Yeah.
I just, it's tough.
Yeah, it is a matter of what your priorities are. And I remember when I found out about the gene mutation thing that, in the grand scheme of things is a little bit scary, but there's so many other things that people are dealing with that are scarier. But I remember thinking, well, this is where I'm going to have to put not only my energy but my money, because this is the rest of my this is the rest of my life.
Yeah.
And so I do understand that this is a hard topic for people who feel like they don't have the means, but that's really important and interesting to know that a lot of places will work with you. And I think the most important thing is empowering women to have that sort of power to speak up, to ask questions, to go to their employer, and not feel scared that just because they're over the age of 35, they need to give up or not go down this path.
Absolutely. And I would say two more things. One, there's companies out there that are giving grants. You can look for them and try to find and apply for grants, interest-free medical loans, things like that. And then the last thing I want to say is everything is a cost-benefit analysis, right? If you're somebody that knows for sure one day you want to have kids, freezing your eggs now actually saves you money later. Because we know that the same patient who's 35 or the same patient who's 40, the 40-year-old is going to take them more rounds in general to achieve that same pregnancy. And so it's really just, it's a cost benefit analysis, but I think for a lot of people, it may end up saving you money. And not only that, if you have a genetic reason to do this, you could be like, I actually saw once a brilliant article that was talking about why IVF for genetic purposes should be covered. And they went through the case of somebody who has like a sickle cell disease, right? Sickle cell costs the patient and the hospital system millions of dollars by the time that patient's 35. And you could decrease that risk, or you could have a baby without sickle cell disease by testing those embryos for sickle cell disease. And that costs not cheap, but it costs about, somewhere between $20,000 to $30,000. It saves you millions in the long run. So,
well, still, but yes, in the grand scheme of things, if I could be empowered to know that my child will not be, facing something like that, then it's worth however much money,
Insurances be covering that, right?
Right.
Then
By the way, to anybody asking, I am not pregnant. Everyone's like, oh my God, you're pregnant. I'm like, no. I'm just having,
can't you just talk about women's health without being pregnant?
People want to, guys, you would know. You would know if I was pregnant. I'm just trying to bring some information to people. But that's really interesting to know. And I think that a lot of women are scared to go down this path because it means something very specific in their mind. They didn't find their person. There's all these different things that have to do with IVF and egg freezing and infertility that have nothing to do with your partner or finding out or finding someone else. This has to do with you and your autonomy. And I think that it's really important to take your power back, and especially as a woman, to be like, no, I can take control of this because this is the rest of my life.
Yes. I think reframing it that way, obviously easier said than done, but reframing it as, being your self-advocate and empowering yourself, as opposed to like, oh, woe is me, I haven't found the right person. I feel like everyone's, we have to get rid of the stigma, really.
Yes, definitely. Well, thank you so much for doing this.
Everybody wants to know if there's going to be another Pitch Perfect. I think that's our most FAQ here.
I wouldn't know if everyone else did. I'm the last person to
Right.
know
This
anything.
Instagram Live is where we're going to be dropping this huge news.
Yeah. Um, and they don't tell me anything, so I have no information for anyone. But thank you so much
Yes,
for
thank
everything
you.
that you've done for me and all the information that you've given me over the past year and a half. And for this, we got through it in terms of, I think we did a good job of not freaking out, or maybe I just did, but I
You
really
made me
appreciate you.
feel better that you were a little nervous, so thank you.
Oh, I'm nervous doing everything. Okay, it's amazing that I live my life. Okay, but I really appreciate this, and thank you everybody for tuning in. And I know that this has been a strange, conversation for many, but empowering for most. So I really appreciate everybody.
Thank you. Appreciate you. Talk to you soon.
Okay, bye guys. Thanks everyone. We
Bye.
did it.
Yay.
I don't even know how to stop it.
No, you're going to press X, and I think you're going to get an option to save it because everybody's asking
Okay.
if we're saving it.
Okay. Oh God. Okay. Help me.
Okay.
All right. Okay.
Go slow. You got